Dr. Piskin, I know you told me that you see children. In fact, you see the children of children by now. And tell me, tell the viewers here, what does a mom have to do, or maybe what does a mom not have to do in order to keep the child's teeth and general health perfect? When does she have to go to the dentist the first time? What should she do as the first baby teeth come out? What should she do as the second one come? And all that type of stuff. Will you shed some light on it?
Well, I think it has to start even before that, Helmut. It has to start with their own oral health. The mother themselves has to have good oral hygiene, good oral health, no disease, because even they've proved. Well, many articles have come out now where gum disease and infections in the mouth can cause premature birth. It could affect the effect of the baby as far as the weight of the baby, low birth weight babies. So the mother is very important to make sure that their health is excellent. As soon as they know that they're pregnant, they should rectify that. The old idea of fallacy was that you shouldn't go to the dentist if you're pregnant is ridiculous. It's more important than ever to go to the dentist when you're pregnant, and to see the dentist even more frequently when you're pregnant. You don't have to have major procedures, but just, again, oral health and get the disease under control. But once the baby's born, of course, you're always kissing the baby, you're cuddling, you're hugging, you're passing saliva. There's a lot of things that can be transmitted from the mother or father to the infant, different bacteria species that cause other problems. So oral health of the parents, even with the newborn, is important. Now, let's get down to the newborn. Getting the newborn used to having something wiped in their mouth, a gauze. They have various things as they get older, 2 months, 5 months, 6 months, that the drugstores sell, where they can go in and just clean the gum from the milk remnants that are sitting there. But don't forget, the teeth are forming even before the baby is born. But once the teeth start coming in, around 5 to 7 months, you want to start using very special little toothbrushes to clean these teeth, to get the baby used to having this happening. But by around 2 years old, the child usually has all 20 of their baby teeth. And it's important that even before that happens, that they see the dentist, that they're used to coming to the dental office and having a great experience and having fun and making sure that everything is developing properly. So by at least 2 years old, even sooner, you want to have your child at a dentist recording what's happening in their mouth. Did I answer your question, Helmut?
Yeah, you did. Now, you did. So basically, when a baby comes in the first time, it's not about fixing things in the mouth. It's getting the kid used to the dentist, and also the cleaning the mouth with the towel before there's teeth out there. I guess gets the kid used to that. Like you got to do something there. So it's not so it's not so heavy contrast when the teeth come out and all of a sudden you start brushing. Now let me ask you, what at home could a mom do in terms of, like, number one, get the child, you touched on it, to get the child to touch, to do brush correctly, and to getting it to like him or her to like it, because sometimes kids maybe don't want to. There's some helping tips. Or for instance, I've heard something about, gum sucking or sleeping with a bottle might have some, might create some problems. Shed some light on that.
Well, many people have heard of baby bottle syndrome, but really don't know what it is. Baby bottle syndrome is where the baby teeth have an extensive amount of tooth decay because the child is sleeping with milk and the bottle at night. The parent gives the bottle to help soothe, but it has milk in it. And in the milk there are sugars, and those are what ferments in the mouth and causes an extensive amount of decay. And all of a sudden, by 2 years old, when all the teeth are finally in, all of a sudden there's decay on these teeth that shouldn't have any. So that's called baby bottle syndrome, and we try to make sure we educate the parents during this time when they come in about things they should or should not do with their children, both good and bad, as far hygiene as far as what they can put in the mouth, what they shouldn't.
I need you to tell me some of those things. I need you to tell me, so don't put the baby asleep with a bottle of milk because it soaks the teeth in sugar, basically. So never mind brushing after dinner. You defeat the purpose by putting it in. But what should the mom do then? What should she fill the bottle with, or just not give the bottle at night before sleeping? What's the deal there? And what other things you educating mom to do or not to do?
Well, I remember with my own girls, the important thing is, they want milk, and I remember with my daughter, you start diluting it a little bit, so that if you want to give them a little bottle before bed, it's either water or you start gradually diluting the milk with the water. So, and I remember the first time I started diluting it, she gave the bottle right back to me. She just knew it didn't taste the same, but after a while, you start doing that, and basically you want to wean them off of being able to have a bottle at night before bedtime. Other times are fine, but more ending or giving them a little bit of water in another bottle after they've had the milk so that they can wash that down. But diluting it and using water as a substitute, they want that suckling effect. And one of my girls wanted the bottle at night. Of course, she got the water, diluted it right away and then water. Another one didn't want it, and they want to have a little pacifier. And that's the other thing I wanted to mention to you was the use of a pacifier is great, but after a while, we have to get those pacifiers out of the kids' mouths. That strong suckling effect can affect the development of their palate. And the way that your teeth develop in the front here, many kids come in, you can just see there's a big space between the top and the bottom, like where their thumb goes. And they're sucking. And they're sucking all night with a very strong passion. And so we either have to get the binky, the pacifier away, and get them to eliminate that suckling habit using their thumb. And there's various techniques we use, but otherwise a lot of damage occurs, and it's hard to correct that. So that's the other thing I wanted to mention. The baby bottle, the milk at night, the idea of the suckling. After a period of time, usually by at least 2, you want to stop with the pacifiers and the thumb. Other habits, they might twirl their hair, they might rest their finger. That's not going to have any harm. That's great. That's pacifying for them, and that's fine. And the other thing you wanted to ask me was you were mentioning to me, what was that helmet about? You wanted to know something else?
I think you answered it, but I'm not sure. Basically, what do you tell, how do you get, just what else you have to do at home, and how do you get children to maybe brush? Maybe that's the one. How, if they for some reason don't want to, what are some of the tools you can use there rather than the whip?
Right. We have like a little timer, a little sand timer, and the kids play with that. They flip it over, and they have to brush their teeth until the sand is finished. It's usually like a 2-minute timer. The toothbrushes today have a lot of fun things on them. They have flashing lights and music, and they wait until the music is over. So there are things. Obviously, at the beginning, the parent has to help the child until they're able to manually, dexterity-wise, do it. But you have to get them in the habit of always brushing their teeth and constantly knowing that this is an important part of what we do every day. Just like taking that bath with the bubbly, they're going to take that toothbrush. And, of course, the young kids, we don't use toothpaste with any fluoride because they might be swallowing the toothpaste. So there's toothpaste out there that have no fluoride in it. It's just the idea of just putting a dab, a little eraser size on there so they get a little flavor. But the idea is to get that brush in there to brush the teeth, and we help educate the parents and the kids and make it fun for them.
So the parents should help the child at the beginning anyway, right? Because, the child just simply is not going to have the perfect motion to do it at all. He'll miss everything. He will, whatever. So the parents should help there, right? They should be physically doing it with the kids' hands.
Yes, right. Sometimes we don't even put toothpaste on it. We just moisten the brush, and we have the parent, the younger kid, put their head on their lap with their feet away from them, and kind of help them at that point while they're lying down, even, or on their belly, brushing their teeth a little bit. And if it's for 5 seconds at the first time and 10 seconds the next, over a period of time, they will get used to that, and they will like it, and they will know this is like bath time. We got to brush your teeth, and they won't fight you. and it'll be a good stepping stone for good oral hygiene in the future.
Oh, good. Well, wonderful. Thank you very much, Dr. Piskin, telling us about how to treat children and what to do. And I think it was very enlightening that you mentioned that a pregnant lady, and for that matter, a father, should have no gum disease because, number one, the mom is subject to maybe get a premature birth and basically passes, just like if a mom would take drugs, I guess, that couldn't be good for the kid. We know that. Kid becomes born a druggie and needs to go into rehab right after born. I mean, we know about that. And so for that much, gum disease passes on the same way. And then there's even the dad and the mom once the baby's born. That's amazing what you said there, that, we kiss and hug the baby and we have all this gum disease in there, and obviously we will pass it on. And then it grows there.
That's right.
In that mouth. Well, again, as I said, thank you very much, Dr. Piskin.